Right, folks, so we're gonna go ahead and welcome to our presentation this evening. My name is Esley Caldwell,
I'm Naomi Caldwell.
and we are with Caldwell Family Wellness. And we're going to be talking today about a new service that we are offering in our practice, which is called medical thermography. We will have about a half hour or so of us kind of talking about it. And then we'll have some questions towards the end. So if you have questions, just hold them until the end. Please keep your microphones muted until we get to that end question and answer period. Thanks for coming out tonight to hear this talk. I think we're going to have some useful information for you. So we are an acupuncture, massage, and wellness practice. And thermography is something that I first heard about close to 20 years ago. One of my first experiences with any sort of holistic practice was with a chiropractor. And this fellow did some thermographic scan of the back of my body, of the paraspinals, and showed some areas of inflammation and areas of concern. And from that moment, I was very intrigued about it. And there are some folks, some friends I have around town that do it here in Cincinnati, and we, over the last few years, have gotten more interested in it ourselves. And so we've been offering this now for the last month or so. And we're excited to share with you all tonight the what thermography is, the benefits, the advantages of it, what it has to offer, what information it brings to help to improve your health. So we will go ahead and get started now.
What is thermography? I'll just read this off to you guys, and then we'll read the slides, and then we'll talk about them, okay? So thermography is also called infrared thermal imaging or thermology. There may be other names as well for it. It's the use of a specialized heat-sensitive camera to detect subtle variations in skin temperature that may indicate disease risk. Do you want to elaborate on that one a little bit?
Yeah, so it's a very, very specialized camera. And when you're looking at the heat that is emanated from the body, there's a lot of information that is being shared. Our skin is the largest organ in the body. And it's important for a number of ways. One of the things that our skin does is our skin is our external interface with our environment. And so we emit heat from our bodies. We absorb heat from the surrounding environment, but there's a sort of interface and interplay of our skin with our environment. And the ways that we radiate heat off of the skin tells us what's happening inside the body.
So this one is helpful in understanding the type of test that thermography is. It's a test of function that helps us understand heat and cold patterns in the body and provide valuable information to discover inflammatory patterns ahead of disease formation. So in a nutshell, it's a test of function. Because we can measure the heat that's being radiated off the body, we can tell things about inflammation and vascular conditions that are happening just under the skin, things that are closer to the surface, right? Because thermography doesn't go inside your body, it's looking at the outside. But we have an opportunity to look at what our body is doing when you can put the key in the ignition and you turn it on. That's what we're seeing. You want to see?
And so when we are talking, when we're trying to understand one of the really big essential points about thermography is that it is an early warning system. So before you get a disease, there is a heat pattern that's going to change in the body. And so the camera can pick up that heat pattern in advance of the formation of a disease, any kind of of illness, and we're going to list through some of the things that thermography can see. But there's changes in the skin, uh, heat being radiated by the body that we can see with the camera.
It's important to know that it's FDA approved since 1982 as a risk assessment tool. It's safe. There is no radiation. So having this done multiple times does not put you at any risk. It's very comfortable, as comfortable as taking a photograph. That's really all we're doing in the room. It's non-invasive, non-contact, and there is no compression. It's pretty much straightforward what it is like for you when you're in the room.
And so there are sort of three different categories of things that we're sort of picking up with thermography. The biggest two are inflammation and circulation issues. And so being able to visualize and see where inflammation is in the body is really, really beneficial. We're going to talk about that a lot more in the presentation. But the vascular circulation issues when blood is not flowing properly to an area, it's going to appear cooler. When there's a lot of circulation, a lot of heat going there, it's going to radiate that heat off. So the vascular issues, what is happening with circulation in the body, we can see that. And then also nerve function. There are some nerve function aspects that can also be seen.
Which also emit similar things. There's a lot of research being done with certain neurological conditions, and thermography seems to be a very effective tool for it, because where there is an impairment, you might see not heat necessarily, but you may see cold, and so it's very valuable information to understanding the root of certain causes.
So we're looking for, looking for abnormal temperature patterns that are radiated by the body. So there's a sort of normal range of temperature, and we're looking for temperatures that are outside that range or that are imbalanced or asymmetrical from side to side, and unusual areas of heat or cold. These may not be areas that you can feel necessarily, or there may be areas that you are acutely aware of. But we're looking for those abnormal changes. We're looking for differences, asymmetry, imbalance. These are all things that we can see with the camera.
It's helpful to understand these imbalances in our body because they alert us. It's an early warning system. I'll just read this. When we can see how our body is functioning, we can make changes that can reverse a potential disease process before it cascades into more serious problems. When you know you're at risk, you can take steps to reverse the risk. It's a lot easier to make changes ahead of a disease. So if you can see the direction your body is heading ahead of something serious, you can make simple changes that can have powerful and profound effects on the direction your body is heading.
And this is one of the exciting aspects of thermography, is that there is a dynamic of empowerment when, especially in the context of its application as an early warning system. It is empowering to say, okay, I can see that if I continue along this track, I might have this condition develop, and I can take steps now, as Naomi's saying, take steps now to remedy and change that situation. So we can change our sort of health destiny, so to speak.
And you get an actual visual of it because we're visual people, so you can see it. It's also giving you motivation to head in the direction. You can see how what you've done is affecting your body, and that is helpful information for you to know if what you're doing is taking you where you want to go.
So these are some of the conditions or applications of thermography. So to understand musculoskeletal disorders and pain, and to sort of identify where pain is coming from. So, there are other diagnostic scans, X-ray, MRI that have a similar sort of use. Thermography is just looking at it a little bit differently based upon the heat. So, especially when it comes to, say, soft tissue sorts of imbalances in the muscle, helping to pinpoint where the muscles are misfiring, or they're too tight, they're spasmed, helping to pinpoint precisely where that is happening. And in that respect, also to help identify the root causes of pain. So those first two kind of go together. Um, we're also seeing that thermography can be helpful, especially when you're doing thermography of the neck. You can visualize the carotid arteries, and so there are applications of being able to see and identify potential risk for a stroke, and any kind of extracranial vascular disease in the head. We can see inflammatory patterns. The blood vessels in the head are very close to the skin, so it's easier to see them there. And then also circulation problems in the hands, especially in the feet and the legs, peripheral vascular disease. This is something else that thermography can see.
Yeah, this tool is being applied in these ways in many different types of medicine. But as far as musculoskeletal disorders, um, it can also help identify areas of weakness. And it differs from other tests because it's measuring heat. And there are in some ways, the information that you're getting from this, it's another piece of a puzzle that can be very helpful in putting together what's happening in your body, what's happening for you. They are all giving you different bits of information. And so it's important to understand that not one test diagnoses anything. What you're doing is gathering information that helps you go in the direction you want to go in.
So these are a few other um, areas that thermography can see to help to differentiate migraines, understand where the source of a migraine could be coming from,
Or the
uh,
type too.
the type of
Right.
migraine.
There's different
Yeah.
types of migraines. And also when you're depending on how you're scanning. So this is like really going through the whole body right now. So in the neck, we can see the thyroid. So in many of these cases, we're able to see the changes again ahead of the development of a thyroid condition. So we're like, oh, you have warmth happening over your thyroid that's out of the ordinary that we've seen. So then we might recommend getting that looked at. Let's see what's going on there. Subclinical sinus and dental infections. Thermography can pick up things that the X-ray actually does not pick up. You can see inflammation that's happening, infection that's happening in the mouth and in the sinus, and it can help direct you to go to your dentist and say, hey, you may feel it, maybe asymptomatic for you, but we may pick it up. And so then you can get ahead of it before you actually do start to feel symptoms and it, goes on and gets worse.
When we say subclinical, we're talking about things that are asymptomatic or things that are not yet at the point where you're diagnosed with something, but there is inflammation there that can be seen, and so that's subclinical. And a lot of people have sinus issues that are just a sort of nuisance that you're not thinking about that much, but there can be significant inflammation that's there. And the same thing in your mouth. Dental, infections that are subclinical, they're sort of minor, but they're there. You're from the Chinese medicine standpoint, um, all the meridians end up in your teeth. So the teeth are connected with the body in a lot of ways. And from the standpoint of circulation, when there's an infection in the mouth, it can be in the blood. And so there are links with dental infections and heart disease and other conditions. And so, finding infections that are there and inflammation that's there and taking care of it before it festers and becomes something more serious, is a big application of thermography. Breast conditions.
I wanted to add to that
Yeah,
really quick.
please.
Also with just you mentioned Chinese medicine, and also from a lymphatic point of view, actually, 1/3 of the lymphatic system is in the head, from the neck up to the head. It's a huge part of your lymphatics. They're opening up to all your teeth as well. You have so many lymphatics in the gum line, and we're about to touch on the breast conditions, and there has been reported to be connections between inflammation that's happening in the mouth that shows a direct line into our breast health. So it's important to catch these things before they become serious. So I'm going to talk about breast conditions because there's a lot there.
Yeah, we'll talk about breast thermography more coming up, but that's one of the main most the areas that thermography is most well known for. Neoplastic and inflammatory conditions. This is talking about development of tumors. And neoplastic, especially in the context of breast cancer and breast tumors, there are a lot of ways that thermography can be helpful as an early warning system for that. And again, we'll touch on that more shortly.
So now we're getting into full body thermography, right? So you can scan different ways, or you can be imaged in different ways. The more information you have, well, the more information you have. I mean, we are a whole, we are not just a segment. Though it is popular to just look at an area of your body that you may be concerned with, breast health, we're going to get into it. It's a very popular area of thermography. But we're going to talk about why you want the whole body done. Identifying areas of subtle inflammation or impaired circulation that may be asymptomatic, as we've mentioned before, at an earlier stage before serious health problems develop. So we've kind of mentioned this already. We're stressing it because it's incredibly important. And we're getting a baseline, honestly, of your whole body. When you're looking at the whole body, you can really see what that whole body is doing. How is the interplay with the whole body? So we're going on to the next one. For example, this is a repeat, but for the asymptomatic and subclinical sinus or dental, signs of chronic inflammation that can wear on the system, pinpoint cause of referred pain. These are all the things we've kind of talked to you guys about already, but this is the type of information you're getting when you do the whole body. I'll go to the next page.
So getting a baseline of where you stand from an inflammation standpoint and also for circulation is also really, really helpful to have that baseline and know, okay, this is where we are now, so you can monitor that and see how things change over time. And again, thermography is an early warning system. Um, so being able to detect and manage conditions before they become too serious is really one of the great benefits. And then also injury prevention. And this is helpful for, for athletes and, for anybody to kind of understand where you have a potential structural weakness, where there's more inflammation or there's impaired circulation that you may not have been aware of. And that is something that could get, have a tendency to get hurt. And you can take steps to strengthen that area.
Even before the pain sets in, sometimes you can see that the changes are happening before you say, oh gosh, I have all this like pain in my hip and I don't know what's going on. And you've gotten to a place with that information where it's just going to take longer to heal.
And another big benefit of thermography in general is to monitor the effectiveness of any sort of treatment you're doing for basically any risk reduction strategies you're doing, like any dietary or lifestyle changes, a wellness regimen. You can see the effects that those modalities have on your body. And so that's also very, very invaluable from the monitoring standpoint. And then if you do have a particular health condition you're working on, uh, we can monitor the progression of that and see where things are going, and use this information to take steps to mitigate those changes if they're negative.
And to see how the therapies are working, to know if what you're doing is um is working for your body, because we're not all the same. And so just because one thing works for one person, it doesn't mean that it's necessarily the thing for you. So helps you find out what is going to work for you.
And now looking at the thermography for the head. So this is showing what's going on in your head. We mentioned in the teeth and the sinuses. It's not up here, but we mentioned earlier the cranial nerves. They can be visualized. The carotid arteries in the neck are supplying blood to the brain. We can see what's going on there from the standpoint of increased inflammation being visible there. Could be an indication of a risk of stroke. And then the cranial is also when you look at the neck and at the thyroid. So now we get to the breast thermography.
So this is the most popular for many people because of what we're able to see, and because of the fact that we don't have any radiation, and um, because of the fact that when if you can do multiple scans without any risk. We're going to get into some of this stuff as the slides go on for different breast types that there are. Um, this type of monitoring works very, very well for everybody. It doesn't matter whether you're a female or a male, for example, or whether you have implants or not, or your breasts are fibrocystic, or um, it's as comfortable as taking a picture of you. Um, so this is also this is the only test that offers risk assessment as the potential to develop cancer. So it's very important to understand the differences. I believe we might get into this a little more in some of our slides ahead, but just I'll touch on it while we're here. Thermography is a physiological, it's a test of function, right? We see what your body is doing physiologically when it's on. Mammograms, the other very popular uh, type of scan that people get for breast health, is a test of structure. Right? So it's important to understand that they work together. The mammogram gives us information about what is structurally developed. The thermogram gives you information prior to the development of that structure. It's information about what your body is doing so that you can get ahead of a mass growing. So let's go to the next slide because we touch on these things. Um, Unusual angiogenic vascular warming patterns, right? So this is kind of what we're seeing when you have your breast image. Because we can see those vascular those vascular areas that come up to the surface, and the heat that they emanate. The interpreter can identify risk from that. There's certain angiogenic patterns that are formed if in precancerous states, right? And so we are looking at those the potential biomarkers prior to cancer happening. And the next slide talks about that, how we can detect this many years before it develops into breast cancer.
And when we talked about the FDA earlier, what the FDA had approved thermography for back
1984.
Yeah, I think it was 82, but
maybe 82.
But yeah, but 40 years ago, they had approved thermography as an adjunctive diagnostic tool to help identify breast disease and breast cancer. And And so in that regard, as Naomi's saying, these changes that happen. So when cancer starts to form in the body, um, and from the thermography standpoint, when it comes to cancer, we're focusing on the breast. So we'll talk about breast cancer. But when breast cancer is developing, there's this angiogenic process where new blood vessels have to get formed. Cancer doesn't like to use existing blood vessels. It makes its own blood supply. And so those changes in the blood vessels create heat, and that's what we can see. And so that heat and the ability of thermography to identify that heat when it first starts, identifying that risk is how it's a biomarker. So that heat, those changes are an identifiable, able to be visualized biomarker of breast disease. And so again, as an early warning system, and then also, obviously, if those blood vessels are developing, working over time, and a tumor is developing, that can also potentially be seen. So when we talk about cancer risk assessment, we're asking kind of two different questions with thermography. Number one, is cancer potentially present now? And we're going to clarify a little bit about what we're saying with this here momentarily. But is it present now? And then secondly, this is where the risk factor kind of comes in. What is the risk of developing cancer in the future? And so again, years before cancer develops, we can start to see those changes. But there's changes that are there that may be visualized by thermography at the outset. And so yeah, we can.
Yeah, I mean, well, we can just, we've talked about this, increases the accuracy of the mammogram. And we are by no means suggesting not to get a mammogram, right? Um, it is a helpful piece of the puzzle for you. The biggest, well, there's a lot of differences, but one of the differences is you can have many thermograms without exposing yourself to any other radiation. And you have different concerns with mammography. Um, that being said, it can help monitor the effects of cancer treatments. This just means that if you know you have had cancer, you've gone through radiation, maybe you've had a lumpectomy, whatever the treatment was, and some time has passed, and now you're getting breast thermography because, well, you want to see how your body's doing. How is it healing? How's that inflammation? You want to prevent it from coming back, right? This is actually, I mean, an important part of understanding how the medications or the treatments that you're doing, the preventative treatments to not have cancer again, are working for you. So lifestyle changes, maybe you've changed your diet, and then you can be affirmed that these things that you're doing are taking you in the right direction. um it's just a whole comprehensive breast prevention and wellness program. It's empowering for you to be an active participant in your health. Um, so yeah.
And just to elaborate a little bit on the first point there about increasing the accuracy of mammograms, um, again, thermography is not a replacement for a mammogram. It's just different information. But when you're doing both, when you're still getting a mammogram and you're doing thermography, the information combined can be helpful in terms of being able to most accurately identify cancer. A mammogram is not going to identify precancer. So that's thermography can also see precancer. The mammogram is going to identify cancer when the tumor is present. It's going to appear as a dense calcium deposits or more fibrous sort of tissue that's going to appear in the mammogram. But thermography is coming at it a little bit of a different standpoint. It can potentially visualize that, but that's really what mammograms are doing in terms of looking at the structural change there. But the big overall sort of benefit with thermography is that as a comprehensive breast cancer prevention program, as a wellness program, it has a lot of utility. And as Naomi mentioned earlier, there are some types of breasts that have a difficult time being clearly visualized with the mammogram. If the breasts are dense, if they're fibrocystic, if there are implants or scarring or surgery, scarring from surgery,
Or they're
that
small, honestly.
right,
They're really
right,
tiny.
right. That can make it more difficult to get accurate information from a mammogram. And for women who have those type of breasts, thermography can also be very helpful to get them good information about what's going on with their health. So it's important to understand thermography is not screening for cancer. Okay, so basically, to be very, very clear, thermography is not a replacement for a mammogram. It's not a
It's
replacement.
another piece of information.
So we're not diagnosing cancer, we're not screening cancer. So we're looking at risk factors. We're saying, hey, look, there's a heat pattern that is abnormal and it is unusual. We need to check this out and do further diagnostic testing to see what this is. So we're not replacing anything else. It's just a different sort of complementary piece.
Thermography works hand in hand with radiology.
Yeah, so working hand in hand with any other kind of radiological assessment you might get, thermography is signaling elevated risk, but a mammogram, ultrasound, MRI is going to detect and say, okay, this looks like cancer. But the biopsy, the only way to confirm if you have cancer, regardless of what the mammogram said, they're going to send you for the biopsy next. The biopsy is going to, go in and take a piece of tissue out and analyze it to determine if that tumor that they found is cancer. So we're not making that determination that something is cancer, but we're giving information that can show that there's a risk that is elevated.
Not any one of these tests, I mean, biopsy confirms it, but not any one of these tests are really, you know, diagnosing you. They're giving you information so that you can take the next step forward and get to the bottom of things. So who needs it? Well, I think everybody needs it. But who needs breast thermography? All women need breast thermography. We say, once you get to 20 years old, it's great to get a baseline. Honestly, it's even better when you're at least at a minimum doing half the body because of that tooth breast connection that can happen, or at the very minimum, the breast and then the cranial scan. So all women over 20, it's great to understand if you're over 20, that's fine. You should get your baseline. The more scans you have, the more you see a history of the change. Anyone who's concerned about radiation exposure, anyone with dense or fibrocystic breasts, we've gone over this, implants, breast reduction, if you've had a post-vasectomy, lumpectomy, or any kind of cancer treatments, maybe anyone at a higher genetic cancer risk as well, can benefit from the extra monitoring of their bodies.
And so, as we've been saying, thermography is complementary to mammography. The mammograms are emitting radiation that's going through the tissue and sort of scanning through it, and then can detect any kind of structural sort of change. Whereas thermography is measuring heat coming off the body. So, mammogram is looking at the structure, the anatomical structure. If there's calcium deposits, denseness that's forming in the breast, whereas thermography is looking at the physiology. So the heat is changing because the blood vessels in circulation beneath the surface of the skin are changing. And if they're changing in ways that are, potentially pathological, we want to be aware of that. And so whether the information is of a structural nature or of a functional nature, both pieces of information are helpful for you to be in the most optimal health and to stay clear of cancer.
So some of the advantages, I think we've touched on these, but we're just gonna, because they're so important, we're gonna mention them again, okay? We can detect and monitor precancerous states. That's prior to the tumor formation. It's just important information to know because it's much easier to reverse. monitor efforts to mitigate them, right? So you can see and be empowered, by things that you're doing to get you back on track. Um, Blood test can measure your estrogen levels. The doctor that we work with who interprets our scan, he is also going to, with breast thermography, he's also going to give you a hormone grade, right? This is assessing what the effects of estrogen are having on your breast tissue, right? So there's certain stages and phases of your life. We're not actually, we can't actually tell you how much estrogen is in your body that you need a blood test for that. We are just telling you the activity that we can see. Um, and it's important to know because you don't want to be in, let's say you have a lot of estrogen activity and you're in menopause, that would be something to be alerted about. So we're giving you that information.
One of the things that we see sometimes is that there are the changes that happen in breasts when a woman is pregnant or lactating, when there's increased blood flow to the breast for circulation to make milk to feed a baby. You don't want to see those kind of changes happening in a woman who's postmenopausal. So when you see it in an older woman who has changes and the heat is looking like a younger pregnant or lactating woman's breast, that's a sign that there's something that's off, and that's how estrogen is having that effect on the breast tissue. Yeah. And then, as we said earlier,
when combined with other tests,
yep, you combine the tests
right,
together, you increase that cancer
right,
detection
you're
rate.
really like hitting it from a lot of angles.
So a couple more points about thermography and breast health. Again, monitoring the effectiveness of any sort of treatment that you're doing. How well is it working? Is it changing the inflammation in the breast? Is it changing how the heat is coming off of the body? How effective are our lifestyle changes? If we've changed our diet, if we're going to sleep earlier, if we're doing intermittent fasting, is this affecting our bodies? And we can see that. Our supplements helping? Are the healing modalities that we're doing helping to lower our risk? We can see that as well. And then also hormone replacement. What effect is that having on the breast? For folks that are taking hormone replacement, that can be an important.
That is so valuable because it's, again, we're not all apples. And so, you want to find the right thing that works for you. And hormone replacement therapy, needs to be fine tuned for each individual that's on it as well. So you want to have that information. So how does it work when you go in to get a picture done? Right. Well, for us, we are doing them in office. Depending on the scan you have will depend on how long it takes. We say about 30 minutes for breast, but truly, once you get to imaging, it takes about 10 minutes, actually, maybe like 60 seconds per image, nine minutes for 9 images. It's pretty quick. The whole body takes longer, so we say 30 to 75 minutes, depending on what you're getting done. There's some paperwork that you have to fill out for the interpreter. There's some steps that you have to take prior to the scan because we are measuring the heat that's emanating from your body. There are procedural steps that have to be done prior to you coming into the office to have your picture taken because we want to get the most accurate reading on you that we can. When you go into the room, this is not all written there, but I'm just explaining it to you guys, what it would look like. You would come in, do the paperwork, come into the room, and depending on what type of imaging you're getting done will depend on what you have to take off. So we can't image you through your clothing. We have a curtain for privacy. I stand on one side of the curtain and you are on the other. The camera is the bridge between us. And so I only see you through the lens of the camera. So I will walk you through poses that I need you to be in prior to starting. You'll sit there and you'll have to acclimate. This is one of the most important parts of the procedure before you get started is 15 minutes of acclimation in a room that that may feel a little bit chilly at first. There is a certain there are regulations for keeping the room at a temperature that gives us the most optimal read. So that we have our own laboratory procedures that we have to follow. This is an important step because it gets your skin and your body regulated with the temperature around it, right? So you might have just come in from the hot summer, and you're sweating and you're hot, or the cold winter, and so we need you to acclimate to get the temperatures inside and outside matched up. And then I will come back in the last few minutes, and we'll get started. And just ask you to go into the positions that you need to get in. And I'm basically just taking a photograph. It's a thermal photograph. So what I'm seeing are the heat patterns, much like the photos you saw in the slide. And then when we're done, I send that off to the interpreter. And usually within a week to 10 days at most, he will have it back to me, and then I will forward them to you, and we go from there. We see, what you've got done, and what he had to say. There's usually recommendations for follow-ups and other things that perhaps he may recommend a mammogram for you, or whatnot. And then you work with us to try to get you going in the right direction. And that's it, pretty much, yeah.
So that is the majority of what we have to present for you today. And now we have some time for questions. So you can feel free to unmute yourselves if you have questions, and feel free to ask those questions now if you have anything, or you can put it into the chat.
Yes, that's what we're seeing.
Hi, this is Carolyn Moore. I just had a couple questions. I've had it done before, and at the time, my DO, he didn't request it, but I just did it on my own fruition. He would not accept the results of it because he said the company that did the interpretation of it did not score it. And he said, I can look at it and I can't interpret it without a score. So my question is, does Dr. Klein, does he do, is his system like a scoring system as to the degree of heat sensitivity? Or
are you talking about having a breast scan done?
Yeah.
Okay, yes. So Dr. Kane will give you a TH reading. That's a TH stands for thermal reading, and there's a scale on that. And he's going to give you the rating for both breasts, because we are looking for the differences. You'll have your images returned to you with a full report, and you also have a hormone grade reading that's being done there, and that's that estrogen activity.
And as a preventative, if there's nothing like major going on, what's the recommendation for getting that?
Yearly, typically.
Yearly.
Yes, like if you're looking good, then you come in once a year and you get to see how you're still doing.
Mm-hmm. Do you have a set pricing for this?
We do have a set pricing. We have them up at the office. If you are,
Okay.
they vary, and we are working on getting that website together. But we have them up at the office. We've only recently launched this. I can tell you a price if you know what you're interested in, because there's so many different there's combinations of that we do.
Well, I would be interested in like the breast one, but then also the dental one. I don't know if that can be done.
Yes, it can. So it's yes, we have an option to do breast and cranial. That's what we would call it. So that would give you the breast and then the head.
Okay.
And that would be $349 at the moment, but at the moment it's actually $249 because we offered everybody back in February a discount, and so it's still standing. We till we think about April is
okay.
and
okay.
So when we launched it, yeah.
All right, that's all the questions I have. Thank
Yeah,
you.
great.
Yeah, thank you, Carolyn. Any other questions? All right.
All right.
If any questions come up, feel free to give us a call, send us an email. We're happy to talk to you more about this. And thank you for listening to our presentation tonight. Have a wonderful evening, and we hope to see you soon.
Take care.
Take care.